Let's talk about fractionated chemotherapy and conventional chemotherapy. In conventional chemotherapy, the physician takes the BMI of a person based on their height and weight. Then, based on the clinical trial outcomes and any accepted parameters of the particular drug, he would prescribe the dosage for that particular drug into the patient. The chemical that he would then be given by his vein will go through his blood and reaches all the cells, but particularly the cancerous cells. The chemical design is aimed at using some different characteristic of the cancer cell and thereby killing the cancer cells. As these cells are dying, they will try to find a way to survive. That's what any biological thing does. Most cancer cells die, but some of these cells will stop growing, almost play dead. As the chemical fades away, they grow back. And some of these now become resistant to the drug when used again. This is called cancer resistance. How to avoid such resistance? One thought is not to play around with low doses of chemical, give the patient the maximum and highest possible dose of the chemical so no cancer cell has a chance to survive in the first place. In full-strength chemotherapy, as the dose is so heavy, it damages the quite heavy too. So apart from the visible damages of hair loss, fatigue, etc., the significant one is loss of blood cells, but most importantly, loss of immunity. Essentially, once you do induce damages to cancer cells, immune cells have a role to play in its elimination. But if you deplete the immune system in the process, the elimination process becomes weak as well. So basically, physicians giving high-dose chemotherapy will have to stop to allow the patient to recover. This means the effective chemical dose is fading away, and essentially, some cancer cells might get a chance to recover and even get resistant. In fact, many cases show this trajectory and a cancer-resistant cancer cell rises. Now, there is another school of thought called fractionated chemotherapy or metronomic dosing chemotherapy and possibly similar other names. But the concept here is to give around 10 to 30% of the recorded maximum dose of the chemical drug. This means less side effects, less severity of side effects too. This means you don't have to stop because of severe damage to immune cells or to blood cells. And so effective concentration of the drug in the body does not drop too low as it does in recovery phase of a full-strength treatment. Dr. Stephen Stegall says in his experience this has been a better approach in every way. Although he does much more than just stick lower dose chemotherapy in his patients, but overall he highly supports fractionated chemotherapy. In my opinion, why it might work better is because if you attack a lump of cells with some chemical, the outer cells die away but in the process absorb some of the potent drug and thus reducing the amount of potent medication in the process. So the effective concentration of a drug that the core of that tumor mass receives is lower than intended in the first place. And now if you have to stop to recover because immune cells were damaged, then you give the chance for a cancer cell to arise resistant. Please do listen to Cancer Secrets podcast for more information of how Dr. Stephen Stegall combines this with IPT, additional testing, nutrition, and much more, as Dr. Stephen Stegall gives many important tips on covering these.